to Deuk Spine Institute live stream. It is Thursday, June 18, 2026. I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. Our patient is a local patient, and he came to us originally with two herniated discs, L4-5, L5-S1, that were causing horrific back pain and leg pain. We performed Deuk laser disc repair, how long ago? A year ago or less than a year ago? 6 months ago. He did fantastic. He was recovering nicely, no pain. And then he went and lifted a huge bag of cement or sand and felt the pop. Well, that pop was a re-herniation. So he is a re-herniation patient at L5-S1, but he did not re-herniate at L4-5. So one of the discs that we repaired is fine. The other one re-herniated. And we told him, give it time. Let's, do some steroids and see what happens. But he came back and said, I can't take it anymore. Go fix me. So that's what we're doing today. If you have questions, feel free to ask. In the meantime, we're going to get access to L5-S1 while you guys watch a nice video on the 30 causes of back pain. I'm Dr. R. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, touches the vertebral bodies. With trauma, can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us.
We are in the L5-S1 annular tear. We're removing the pieces of re-herniation. Remember, this patient had laser surgery, what, a year ago, do we say, or 6 months ago, sorry. And he basically overdid it one day and re-herniated. So we're now back here doing a second laser surgery at L5-S1. But the good news, he did not re-herniate both discs. He only re-herniated one disc. We treated L4-5, L5-S1 6 months ago. He did fantastic. His back pain was gone. He was so happy, but then he went and lifted some heavy concrete or sandbag and felt a pop in his back. He knows he's not going to do that again. He's going to give his disc a year to heal. Our re-herniation rate is 1%. That means 1 out of every 100 patients will re-herniate. That is our number. It's been held true for 20 years. We've done this surgery. It is not a complication to re-herniate. It is basically just, unfortunately, a possible outcome, natural history. But it always happens when people lift something from the ground, which is why I tell them no bending over for 6 weeks, and don't lift anything over 40 pounds or carry anything over 40 pounds for 1 year. Even if you follow the instructions, there is still a chance you'll re-herniate. Okay? I've had some people re-herniate at night while they're sleeping. And there's not much you can do about that if you're tossing and turning in bed. But let's show the audience why herniated discs cause pain. I want to show them an animation that explains how we injure our discs through trauma, and that trauma then leads to something called a herniation, which then ultimately leads to inflammation and pain. The pain comes from the inflammation. Eliminate the inflammation, you eliminate the pain. There is the inflammation right there. You guys see that at 12 o'clock? That red stuff is the inflammation. I'm going to use the laser to remove it, and now his pain will be gone. Let's show them the videos.
Disc injuries start with an annular tear. Damaged nucleus. Pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
You see from our video how an injury to the disc causes an annular tear. You then get a herniation, which then results in inflammation. The inflammation is what causes the pain. We saw the inflammation just a moment ago. It's a pinkish red color, should never be inside the disc, yet we see it here in his disc. I've removed about 20 pieces of herniation, and we're just about done with this disc. I'm going to show you some of the herniations I've taken out in just a moment. Any questions?
Yes. We have a question from Jamie on YouTube.
Hi, Jamie. Welcome to our live stream. Sure.
I am curious, if after healing, can you play sports like tennis or pickleball? Would that have to be 1 year after surgery?
That's a great question, Jenny. So the Jenny's saying, Dr. Deuk, when you do these laser surgeries and fix these people's back pain with removing the inflammation and herniations, can people go back to pickleball? The answer is yes. Can they go back to tennis? Yes. Can they go back to every single activity they want to do in life? The answer is yes. But the safest thing to do is to wait a year, but generally depends on your disc herniation and how well the surgery goes. If you have the type of herniation that heals quickly and you have, really good surgery here at Deuk Spine, you can go back to those activities very quickly within weeks or months. I have some people that go back to golf the same day or the next day after surgery. I have other people that have to wait 6 weeks. It all depends on the kind of herniation they have and what the disc looks like during surgery, okay? If their disc looks like it needs more time to heal, then I'm gonna tell them take more time before you go back. Great question. All right, we've got about 30 seconds left. Any other questions from our audience?
Yes. We have a question from Lanu on YouTube.
Hi, Lanu.
Is it possible to have a herniation on both sides?
Is it possible to have a herniation on both sides? The answer is yes. A lot of people do. In his case, he only had a re-herniation on the left side. You can see right here, inflammatory tissue and herniation. We're removing it with the laser. Very precise procedure. There's a little bit of difficulty seeing, like we normally have a crystal clear picture, but we have a little bit of difficulty seeing here for you guys because there's some blood in the water. And the reason there's some blood is because he has a lot of inflammation. Inflammation brings blood. I'm going to clear up the picture in just a moment, and then we're going to be done. Are there any other questions?
No questions.
All right. We're pretty much done here. I've gotten all the pieces of herniation out. I'm going to show them to you right now. Give me 1 second, and I'll show you the herniations. All right. Anthony, can you see the herniations?
Yes, we can.
All right. It's right here. You guys see this? We have about, 10 pieces there. The biggest one is about 1.5 centimeters. And there are even more pieces than that fell off the side of the table down here. So all of this was done through a 7mm incision. The only place in the world you can get this state-of-the-art advanced surgery is here at Deuk Spine. There is nowhere else in the world because we pioneered this surgery. And it is literally the best surgery in the world for a disc problem in your back or your neck. Thanks for joining us. He's going to go home in about 30 minutes.
I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. I have a patient with me who just had the Deuk laser disc repair less than 24 hours ago, about 12 hours ago. And here you are. How do you feel today?
I feel better than I have in probably half a year, I'd say close to 5 or 6 months. It's one day after and time will tell, but I didn't think this was possible this quickly.
Yeah, time will tell. We've done now 2,200 of these surgeries with the laser endoscopic. Consistently, the pain is gone. It's permanently gone. It never comes back. And so I'm excited for you that you're gonna do fantastic. Now, you live about an hour away. How did you find out about Deuk Spine Institute?
I got a referral and noticed that it was only an hour away, so made my way up here, and the first time I came for a visit was kind of felt like home, kind of felt like where I should be anyway, so that kind of fit right into everything this far. So
You had, was it back and leg pain, correct?
back pain a little bit, but my biggest issue was shooting down the leg pain. It was numb all the time for about 4 or 5 months on and off, so didn't know what else to do, and this was the right choice, I would say.
You came to us and we found weakness also. You had weak pulling your toe up. That's because the nerve was pinched so bad at L5-S1. You can see here on the video, we went in with a tiny Band-Aid incision, 1/4 inch. We went in and basically removed most of the herniation, cleaned up the tear where it came out of so that the tear will now heal. Your disc will heal naturally. And we did it all without removing bones or ligaments. If you had had a microdiscectomy or laminectomy, which is what every other surgeon offers, because they don't know how to do the endoscopic surgery, it's a newer technology, then you would have had a bigger incision, you'd be in a lot more pain today, and you'd have bone and ligaments taken out of your back. It would weaken your spine, which would set you up for fusion. But with our surgery, there is no need for any future treatment on the disc. It's permanently fixed. Now, are you taking any pain meds today?
I haven't yet today, and I haven't felt the need to, which was another surprise I had too.
Yeah,
So
no pain meds, right?
Nothing.
No bleeding, no hospital, no pain meds.
Nope, in and out pretty quick. It worked out pretty well.
Pretty happy?
I am.
And you were referred through Coral, right?
Correct,
Coral
correct.
Network.
Coral Network.
What do you have to say to the Coral people who approved your surgery?
I just appreciate the approval and the opportunity to live like normal and be a normal human again.
Yeah, Coral did you well. I guess they somehow got you to us and you avoided having an invasive surgery that was going to hurt you more than help you.
Correct.
Congratulations.
Yeah, well, thank you, Doc.
Anything else you want to say to your fans out there in YouTube land?
I would just encourage you to look into Deuk Spinal and figure it out if that's the right fit for you, and it was for me, absolutely. So, thank you.
You're welcome, my friend.
Appreciate it.
Congratulations.
Take
Take care.
You too.